Okay. Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Paradise Valley, Scottsdale area for over 21 years, and I practice only cosmetic surgery, or aesthetic surgery as we call it. A lot of my practice is plastic surgery of the face, and a very common question is that people come in and they want to know what's entailed when you have your eyelids performed in terms of eyelid surgery, and it really depends upon what we do. When somebody has eyelid surgery, we perform either upper or lower eyelid surgery or blepharoplasty, or sometimes, most commonly, with those two combined. Generally, when we do the upper eyelids, a small incision is made right where the eyes open and close, so that's hidden, and it falls in a crease that exists there automatically. Through that incision, we take out a little bit of extra skin, and some puffiness is usually on the inside of the eyelid there, to leave you with a much crisper eyelid that really doesn't change the shape of your eyes. So the upper blepharoplasty is performed through an incision in the upper eyelid. A lower blepharoplasty, a lot of times people need different things based upon their presentation. Some young people or people in their early 30s and 40s that come in have had puffiness in their lower eyelids since they can remember, and that tends to be a hereditary kind of thing or familial. Sometimes we can take that out through an incision performed just on the inside of the eyelid with no external scars. Oftentimes I'll combine that with some laser resurfacing to get rid of some of the extra skin in combination with having that fat removed. And almost always I will take some of your own fat, spin it in a centrifuge, and inject that without an incision through a small needle hole near the cheekbone into the lower eyelid area to make it nice and smooth and make the contour look much more youthful. Lastly, there are people that have a lot of skin laxity, a lot of extra skin, and in those people we want to take out the fat, also make a small incision right at the eyelashes. You won't know that I've been there, and remove some extra skin like a pinch, and that will leave the eyes looking much softer, more well-rested, and still in combination with that, I almost always will inject some of your own fat. So the bottom line is, I want this to be your secret. I want you to feel like you look more well-rested. I want you to feel like you look more handsome or more beautiful without anybody knowing that I've been there. Thanks a lot.